guys, and welcome to How to Gastro. In today's video, we'll be covering a very common pathology, and that is type 2 diabetes. So let's get started. So what is type 2 diabetes? So type 2 diabetes is a disorder which causes high blood sugar levels due to poor insulin metabolism. There are two main causes for this. So firstly, we have the insulin resistance, which means that the cells of the patient's body do not fully respond to the insulin that is released, or that the insulin which is present doesn't work as effectively or as well as it should. And the second cause could be the lack of insulin, and this may occur because over time, as the patient ages, the pancreas produces less and less insulin, and eventually the pancreas will stop producing insulin as time goes by. So all this fancy explanation really means is that type 2 diabetes is a somewhat relative insulin deficiency, meaning that we do have insulin present, but it either works ineffectively on the body cells or the body doesn't respond to it in a way that is effective enough. So if we take a closer look at this image on my right, it tells us the steps involved in type 2 diabetes. So we have the stomach, which converts the food to glucose. So after a meal, all the food we ingest is created into glucose, which is the main fuel product that drives our body and all its functions. So the glucose then enters the bloodstream, and after this, the pancreas will produce insulin, but because in type 2 diabetes, it is resistant to effective use, the glucose will be unable to enter the body effectively, and in time, the glucose levels will increase. So insulin, which is produced by the pancreas, or the pancreatic beta cells to be more specific, is very important in controlling the blood sugar levels. So when the food in our stomachs is converted into glucose, it requires insulin, which is produced by the pancreas, in order for it to be used by the body to fuel various tasks. But if we have faulty insulin, or not enough insulin, or insulin that doesn't respond very well, or doesn't function properly, you'll see how we'll have increasing levels of glucose in the blood. And this is basically what type 2 diabetes is. It's sort of an ineffective function of the insulin available. So what are some signs and symptoms of type 2 diabetes? So patients will usually complain of increased thirst, frequent urination, increased hunger, unintended weight loss, fatigue, blurred vision, sores that heal very slowly, which are usually located in the extremities, most commonly in the feet. They are more prone to infections, so they have frequent infections, and they will also have areas of darkened skin, usually on the armpits or the neck. And if it occurs on the neck, it's actually called acanthosis nigricans. And I did explore this in great detail in the hyperglycemia video, so I will put a link in the description for it in case you want to check it out. So what are some risk factors for type 2 diabetes? So the first one is weight. So being overweight is the main risk factor for type 2 diabetes. Fat distribution. If the patient stores more fat in the abdominal region, they usually have a greater risk of developing type 2 diabetes. Inactivity. The less active the patient, the greater the risk of type 2 diabetes. Family history. The risk of type 2 diabetes increases if the patient's parent or sibling also suffers from type 2 diabetes. Race. Black, Hispanic, American Indian, and Asians are usually more likely to develop type 2 diabetes. Age. The risk of type 2 diabetes increases as the patient ages. Most patients are diagnosed after the age of 45. Prediabetes. So prediabetes is a condition in which the patient's blood sugar level is higher than normal, but not high enough to officially be classified as diabetes. So if left untreated, prediabetes often can progress into type 2 diabetes. So this is another risk factor. So polycystic ovarian syndrome can also be a risk factor. Female patients who suffer from PCOS also have an increased risk of type 2 diabetes. And finally, patients who present with areas of darkened skin, as we mentioned in the previous slide, usually in the armpits and the neck, and this condition often indicates some sort of insulin resistance. So these are all risk factors for type 2 diabetes. So now let's talk about the diagnosis of type 2 diabetes. So the blood tests are very helpful in helping us to diagnose a type 2 diabetes. So the first thing we do is a glycated hemoglobin test, which is also known as an HbA1c test. And an HbA1c level of 6.5% or higher on two separate tests means that the patient has diabetes. We can also do a random blood sugar test, and a level of 200 milligrams per deciliter, which is about 11.1 millimoles per liter, or higher is also suggestive for type 2 diabetes. We can also do a fasting blood sugar test, and here a level of 126 milligrams per deciliter, which is around 7 millimoles per liter, or higher on two separate tests is suggestive for diabetes. And finally, we can also do an oral glucose tolerance test, and here a level of 200 milligrams per deciliter, which is around 11.1 millimoles per liter or higher after 2 hours, is suggestive for diabetes. And finally, let's talk about the treatment of type 2 diabetes. So the complete management of type 2 diabetes includes treating a multitude of aspects, including patient weight loss, healthy eating by the patient, regular exercise by the patient, and oral diabetic medication, or even in some severe cases, insulin therapy. So the weight loss, healthy eating, and regular exercise is very important because physical activity and decreased weight automatically will lower the blood sugar. So we advise the patient to start off with some small exercise routines, at least 3 times a week. We give them a dietary plan to follow, which can help them lose weight and eat healthier. And of course, we can supplement all of this with the prescribing of some diabetic oral medications. So let's explore those a little further. So some common diabetic drugs include Metformin, and this is commonly known as glucophage, Glumetza, or others. And generally, Metformin is the first medication prescribed to patients for type 2 diabetes. It usually works by lowering the glucose production in the liver and improving the body's sensitivity to insulin, so that the body uses insulin more effectively. Another class of drugs are the sulfonylureas, and these medications help the body to secrete more insulin. And examples include glyburide, which are commonly known as diabeta and glinase, glipizide, which is commonly known as glucotrol, and glimepiride, which is also commonly known as Amaryl. Another class of drugs are the meglitinides, and these medications, such as repaglinide, which is commonly known as Prandon, and ateglinide, which is commonly known as Starlix, work similarly to the sulfonylureas by stimulating the pancreas to secrete more insulin. But they usually are faster acting, and the duration of their effect in the body is shorter. We then have the thiazolidinodones, and like metformin, these medications, which include rosiglitazone, which is commonly known as Avandia, and pioglitazone, which is commonly known as Actos, make the body's tissues more sensitive to insulin. We then have the DPP4 inhibitors, and these medications, such as sitagliptin, which is commonly known as Januvia, saxagliptin, which is commonly known as Onglyza, and linagliptin, which is commonly known as Tradjenta, help reduce the blood sugar levels but tend to have a very modest effect. We then have the GLP-1 receptor agonists, and these are injectable medications which slow the digestion and help lower blood sugar levels. We also have exenatide, which is commonly known as Byetta or Bydureon, liraglutide, which is commonly known as Victoza, and semaglutide, which is known as Ozempic, are examples of the GLP receptor agonists. We then have the SGLT2 inhibitors, and these drugs prevent the kidneys from reabsorbing sugar into the blood. Instead, the sugar is excreted into the urine, and examples of these drugs include canagliflozin, which is commonly known as Invokana, dapagliflozin, which is commonly known as Farxiga, and empagliflozin, which is commonly known as Jardiance. And finally, in very severe cases, in patients who are unresponsive to oral medication, we can also supplement the treatment of the high blood sugar levels with insulin. So if oral medications do fail to treat these patients and to lower their blood sugar levels, the patients can be placed on insulin. And that brings us to the end of this video on type 2 diabetes. Thank you guys so much for watching. Hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe, and share. And please make sure you turn on your bell notification so you'll be notified every time we have a new upload. If you'd like to download a copy of this presentation, you may do so by clicking the link in the description. Take care and bye for now.